topic that I chose to focus on were common issues associated with poor hygiene in dentistry. My name is Chelsea Ebert again, mentor Dr. Gordon, of course. Location right here at his private practice and profession dentistry. And this is for the fall 2016 ISM course at Clear Springs High School, taught by Mrs. Click. And just a small disclaimer, some of the information from this presentation comes from outside sources because we were required to do research for it. So a little bit about Dr. Gordon. This was required for the presentation, so I'm sure you all know this. But that's a picture of us, and he has been practicing in the area since 1990, so over 20 years of practice. The address for the business is right up there. He's a member of many different dental associations, including the the Greater Houston Dental Association, the American, as well as the Texas Dental Association. And he graduated from Tulane University, then went on to pursue dentistry at the University of Texas Health Science Dental Branch after doing some research with cancer, actually. So what is ISM? ISM stands for Independent Study Mentorship, and it's a class that we take at Clear Springs High School that basically allows us to go out and study a profession that we're interested in pursuing, to kind of get a feel for the career field and see if we are interested in deciding on that as our career. It allows students to shadow their mentor weekly, and it also requires collegiate level work. We do a lot of projects in class, small assignments, and we are required to create a website to kind of showcase what we have learned throughout the course of the semester. And this is a screenshot of my homepage of the website, and it basically just says the topic as well as the purpose of the website. And I'm not sure if I mentioned, but those are grading rubrics. Sorry. Those.
Okay.
Sorry.
Sure, thank you for that.
And then this is just another screenshot, a couple more screenshots of the website. Those are activity logs that we're required to fill out after each visit, as well as a mentor poster project, which we completed at the beginning of the semester to just kind of summarize what we are planning on pursuing and what we're going to be studying throughout the semester. A screenshot of the research page for the sources that we were required to research for this project, as well as a screenshot of the interviews which we were required to take in order to kind of get a feel for the field on a more personal level and how people in the field actually view it. So what is dental hygiene? Dental hygiene includes anything about taking care of one's teeth. Now, this is not only the correction of issues, but also the prevention of issues. Dentists come across many different problems in their field, and they're required to basically find the best treatment plan for the patient, and that may vary from patient to patient depending on their personal conditions. And they also have to educate their patients on good dental hygiene and the preventative measures that they might be able to take, such as sealants or things of that nature, in order to prevent any future damage to their teeth. Now, why did I choose the specific topic of dental hygiene and the issues encountered? I thought it would just give a very good overview of the field in general and some of the procedures that I might encounter if I did choose to pursue the field. So I thought it was a good overview. So some of the aspects of dental hygiene, your teeth obviously are very important to your mouth. They not only help you to chew, but they also provide structural support for your teeth, or for your face, so that's why if you didn't have them, you'd need to get dentures. But they also do contain immune cells, so you want to keep as many of those as possible to help your body fight invaders. It's important to visit the dentist for regular cleanings at least once or twice a year, as well as to brush twice a day and floss daily. And something I read I thought was interesting, that it's best to brush at a 45-degree angle to the gum line. I'm not sure if that's true, but and then sealants. Sealants. I learned a lot about those, and I learned that they're becoming a lot more popular with the younger generations, and because of that, the patients are not seeing as many cavities and as many issues with their teeth or complications, so that's a good thing. So some of the possible issues that can be encountered, there's cavities, which are basically a decaying tooth, abscess teeth, where it's it's a little more serious and the infection actually travels up the root. There's dry sockets, tooth sensitivity, wisdom teeth, which might obstruct other teeth and cause other complications, so you might have to get those removed. There's also sensitive teeth as well as gum disease, and gum disease is very rare, but it's also very severe. It can be caused by multiple things. It's not curable, but it can be slowed. And I learned that it's more common among people with diabetes just because they do have like a higher risk of infections and diseases in general. And it can affect a lot of things, even like babies, newborn babies if the pregnant mother has it, or it can even affect heart diseases to worsen them if someone has a heart disease. One of the dental procedures that I researched was root canals, and they're performed by dentists or endodontists who specialize in them. And they're basically an attempt to save a tooth that's become really badly infected up to the root. So in order to save that tooth, they can be caused by many different things, such as cracked teeth, a really bad cavity, or even too much dental treatment to the area can kind of irritate that and eventually cause an infection. The procedure is that a local anesthetic is applied to the area, and then the dentist uses a cover to isolate the area, and this is not only to prevent any instruments from falling into the patient's mouth, but it's also to just create a clean workspace for them to be able to work with. Then they file out the damaged tooth pulp, clean the cavity with a disinfectant, and then go in and fill the roots and the tooth socket, and then seal it. Another dental procedure, a couple other dental procedures that I researched, there are dentures and bridges. So dentures, there's two types, partial or full, and they're actually held in place by an attraction between the saliva and the gum, which I thought was interesting. And bridges, there's two types of bridges, and a bridge is basically to replace one tooth by attaching to two other teeth beside it. There's removable and fixed. Fixed are generally more stable and they're obviously more permanent, but the downfall is that you do have to file down two good teeth on either side of the missing tooth. So you basically lose two to gain one. But the partial ones aren't as stable and they require more maintenance, and they're not like a real tooth. They're less like a real tooth. Another dental procedure that I researched was implants, and these are a much more serious procedure because they can require several visits. And the reason for this, over the course of several months, the reason for this is because the bone does have to form back around the implant after it's placed in before that attachment can be placed on it, whether that's a denture, crowns, or bridges. But patients do say that it feels more natural. It is a lot more stable because it's in that jawbone, but it is a bit more serious of a procedure. Another form of dental care that is becoming more prominent, I guess, in today's society are those that deal with aesthetics. So there's veneers, which are basically a really thin 2 to 3 millimeter layer on the top of the tooth, and they can correct any discolorations, any cracked teeth, or even misshapen teeth. And they basically just make your smile look pretty. There's also braces and Invisalign for any teeth that didn't come in straight, and to basically help you get that desired smile. This is a picture of a brochure that we completed in class based on a survey we took, and I believe I got about 54 responses. And the 3 hypotheses I made at the beginning were that those with sealants will have fewer dental issues, males would have more dental issues than females, and that the older you get, the more dental issues you would have. And I did find those to be correct according to the responses, except the male-female one there wasn't a strong correlation, but the females had a slight lead. And I did find that those with sealants did have a lot fewer issues, and those who answered and said that they did have sealants were basically the ones who were in the lower age groups. So I guess it's becoming more popular with the younger people. These are a couple slides on artifacts. So we were required to collect 10 artifacts from our mentorship site. That's an image of a root canal that Dr. Reyes performed after it was completed, so you can see it right there. that is an image of the work schedule that y'all have to basically keep track of all the patients and keep organized. There is a brochure of sealants to basically keep the patients informed and have them aware of the procedures that might be completed. And there's a continual education certificate from DD. So that basically shows how dentistry is an evolving field, so it is important to keep that education. There's a patient consent form for a surgical dental procedure. So to make sure that the patient is aware of everything that's going on and there aren't any insurance issues afterwards. And there's also a dental assistant certificate from DD. Upper left-hand corner, there's the tooth numbering system diagram. Basically shows how y'all number teeth. There's a calendar that helps y'all that y'all use to help coordinate with the lab and find out when the correct date for crowns and things of that nature would be. There's also a post-operative procedure, list of procedures for the patient after they've received a procedure, as well as a diagram of before and afters for some of the different dental procedures that I researched, and it basically shows like the pros and cons of some of them and how they work. There's an X-ray machine, which is used often, as well as just a business card for the patients. So the product that I created, it's right up here. To showcase what I learned throughout the semester, I made 3 hypothetical patient files. One of the patients was to have a cracked tooth, and the dentist was going to go in there and find that it had a really bad infection and therefore it would need a root canal. The second patient was a child who would have no apparent issues, but of course we're going to go in there and do that yearly or twice a year cleaning and clean off all of that plaque on their teeth, and then put in some sealants to make sure that they don't have any future issues. And the third patient was going to have a toothache, and then the dentist was going to go in and find that they had a small chip on the side of their tooth and it had started to decay. Sorry, okay. Are you sure you don't need to?
No.
That's fine. This is the image of the first one of the patients. It's the child, his file, and it basically has all of his information and then a list of his appointments and the different procedures performed on them. So it looks like he's been going to the dentist for a while. This is the second patient. This is the one who needs a root canal. This is the one who needs a root canal, and as you can see, there's, this is the cavity. It's out of order, sorry. He needs a cavity, and you can see the before and after x-rays right there. And, then there's also an image of the one who needs a root canal. And that's just the works cited for my product to basically show where I got these sources for my images as well as the basic layout. So in conclusion, working with Dr. Gordon has been a really great experience, and I've learned a lot about dentistry in general, and I thank you so much for giving me the opportunity to come here and watch and learn what y'all do. Throughout my experience, as well as through the interviews, I've learned a lot about the importance of dental hygiene. I've seen a lot of patients with some bad teeth, so that's really encouraged me to brush and floss more. And I've also learned about their solutions, and they're a lot more complicated than they might seem at first glance, or just after reading about them. I've also learned a lot about the importance of customer relations after seeing how you run a business, and I've heard on multiple accounts that the patients, the reason why they come in is because they love the friendly atmosphere and how it almost feels like a family here. So I've learned that that's a really important aspect of the business, or of the field, career field. I've also learned that it might seem easy, it might seem like good hours, but it is a difficult job, and there are days where you can go overtime a lot. And owning a business can be both rewarding and stressful. But you have to just do it for that satisfaction, I guess, of seeing the patient smile at the end and seeing their final outcome. I've also learned a lot about like the field in general and about how it is a stable field because people will always have teeth and they'll always need dentists, but it also is evolving in the way that there are new technologies coming out and there are other businesses coming up, bigger corporations, I guess, kind of taking over the field in a way. So. And I would like to give special thanks to my mentor, Dr. Gordon. Thank you so much for giving me this opportunity, as well as my teacher, Mrs. Click, for providing me the opportunity and letting me into the class, as well as all the wonderful workers, and Judy and Rochelle at the office that have just been so welcoming and kind. And thank you so much.
That was wonderful.
Well done.
Good job.
Are there any questions?
2 thumbs up.
Yes, yay.
And
I think you did very good.
I do.
No, it's fantastic. You really have a comprehensive understanding of what's going on around
Yes,
here.
you did.